My philosophy on addiction is a little bit different than what is the pervasive model in the industry. I feel that addiction care does not have to be premised on the fact that people have to hit rock bottom. I think there should be plenty of opportunities for intervention, for early intervention and preventative care. And I think one of the most difficult things in addiction is the lack of approachability. So I think that if in our center, if people want to come in, it's an easy transition into the addiction world in a highly professional, easily approachable way. What we did with our center is we tried to put it in a medical office park because we view it as it's New Life Medical Addiction Services, and we view us as part of the medical community, not divergent from the medical community. And we want it to be smaller, we want it to be more intimate and approachable. We want it to be approachable not only to the individuals, but we also want it to be approachable for referring physicians, because we think that a referring physician should be able to get an addictionology consult in the same fashion that they would get a gastroenterology consult. And so that's kind of a new way of doing things, because I view the medical world as a triangle where you have primary care, you have specialty care, and then you have a hospital. The job of a physician, which I've been a physician since I finished training in 1993, the job of a physician is to mitigate the upward migration of the patient, because that is reflective on better preventative care, and also it's quite cost effective to try to get care earlier, sooner, and less expensively. Now, the big problem with addiction is it's turning that triangle upside down, and the inpatient facility is your highest price point, but it's also your entry point. And I think that represents a major problem with the way addiction care is delivered. That should not be the entry point. First of all, we allow for a medical evaluation of a patient to determine their level of care. And we can take people either who walk in the door, or we also can take consults, as I said, from other physicians in the area. Now, that being said about us having very much of a feel of a medical office, we are a New Jersey state licensed facility, and we hold 6 state licenses, and we're accredited by the Joint Commission, or JCO. So we're a facility, but we're a different kind of facility. So I think in this setting, we can offer people the opportunity to come in, get an education, get offered the proper treatment across multiple modalities. And if they need a higher level of care, we're happy to send that patient to a higher level of care. And we have a lot of people in the industry that we work with and that we think highly of, and we want the patient to be in the right place. But the other thing that happens in our model too is if we have the opportunity to do an evaluation on a patient, that patient may need inpatient care. They might need a 5, 7, 10-day detox, or they might need a 30-day program. But the patient's going to get out, and upon discharge, if they call us, they're already plugged in. Like they'll get their counseling scheduled, they'll get their MAT, which would be like Suboxone or Vivitrol medications. We'll provide for that immediately. And so it's a very nice addition to the addiction terrain. But also the other thing is a lot of patients have substance use disorders and are in the community. They have families, they have jobs, they have a life, and they may be fence sitting. Part of their brain is telling them that, oh no, well, I go to work, I'm very successful, I don't really have a problem. And then the other part of their brain is saying, well, I'm not interacting well with my family, I have trouble in my marriage, I am struggling a little bit at work now, maybe I do have a problem. So those kinds of patients their concerns need to be addressed. And one of the things for our recovery programs is that we think the family is very important, and staying in the family, and also people's occupations We think your job is part of your recovery if we can make that a part. So that's one of the reasons why we're open 7 days a week, and we have counseling not only for during the day in a hybrid model with online or in person, but we also have evening counseling, because if somebody has a job and they're able to keep it and they're at a stage where they can still provide for their family, we think that that's a major part of what we're trying to accomplish.